Hello and welcome to the next episode of the Explain series with the host, Dr. Brett Palmer. In the Explain series we take a sexually hot topic and explain it, and this week it's the turn of the progesterone-only implant. Now the progesterone-only implant is an implant which sits in your upper arm and is filled with progesterone, which it slowly releases over a period of 3 years. So once you've had the fitting procedure, you can forget about contraception because you're effectively sorted for the next 3 years. After that 3 years it has to be removed, it can't just be left in there, and it's either removed and you go into another form of contraception, or you try for babies, or alternatively you get it exchanged. Exchange means it's taken out, then a new one is put in. And at the end of this video, you will be seeing the exchange procedure on how an implant is removed and how a new implant is put in. And so what are the advantages of the progesterone implant? Well, the advantages are simple enough. Once it's fitted, and it's fitted in your non-dominant arm, so if you're right-handed, it's fitted into your left arm, and if you're left-handed, it's fitted into your right arm. And it's usually trouble-free. Once it's fitted you can forget about it, but obviously it doesn't protect against sexually transmitted infections. For that you need some kind of barrier method like condoms or femidoms, but they're only about 95% effective, give or take, and so that's why if you want to prevent babies you need contraception, and if you want to prevent sexually transmitted infections, you and your partner should get tested before you embark on a sexual relationship. If you have lots of partners, then you need to get regularly tested anyway. Another advantage of the progesterone-only implant, apart from once it's fitted you can forget about other forms of contraception, is it can stop your periods, which for some women that's a great thing, especially if you have troublesome periods, and especially if they're unpredictable. Progesterone-only implant can stop them. However, a disadvantage is it can also lead to intermittent bleeding or bleeding at times where you're not expecting it. And so if you have a very regular period, this may mean that a small proportion of individuals may experience bleeding infrequently, like once a month or maybe once a week, and if you're very unlucky, once a day. If that does happen, you can be given either a progesterone tablet for a few months, or even a combined hormonal tablet if you're able to take them. If it's that troublesome though, the implant can always be taken out. It's a fairly simple procedure. It's usually fairly painless if it's done correctly and you're given the correct amount of anaesthetic, and the removal procedure only takes around about 10 to 15 minutes, as you will see at the end of this video. You can get further information about the progesterone-only implant from NHS Choices website on the Family Planning Association, and there's various other reputable charities out there that can explain more about the progesterone implant if you need it. One thing which is very important, before you go for your implant fitting, you will be tested to see if you're pregnant. You should abstain from sex for 3 weeks, or you should be on some other form of birth control, for example the progesterone-only pill, and those methods need to continue for 7 days after the fitting. So it needs to be fitted. So if it's fitted on the Monday, for example, you use the progesterone-only pill and or condoms for the next 7 days, okay? Or you abstain from sex for the next 7 days. Alternatively, another time for fitting it is in the middle of your period, if you're not using any form of contraception at the moment. So, any further information, you can also ask your sexual health doctor or your family doctor, and they should be able to answer all your relative questions. So, anyway, I hope you enjoy the video, and take care and have good sexual health. Thank you. I'm just trying to break the capsule which the implant is in. As soon as we break the capsule, it should ideally pop out. Now you can use some forceps for this as well to grab the implant. But the important thing is to take your time And also make sure the patient is fine. You okay?
Yeah.
And eventually the implant will pop out. It's important to have patience. Now, you don't always need forceps, but sometimes you can just grab it with your fingers. Unfortunately, if you don't have any fingernails, it can be quite difficult to grab. That's okay, the implant's practically out. Just covered with a little bit of a capsule. You just need to cut around that capsule. I'm not cutting into the skin anymore, and the procedure for removal is near enough finished. Look at this. Relax. You okay there?
Mm-hmm.
That's all done. Okay. And that's how you remove an implant. So you've got a little bit of a hole there. So that's all done. Okay, the next thing we do is just now get the new implant. And so with the implant, you just check that the implant is in the deposit needle, and then you place up to 45 degrees, just seeing the bevel, and you insert it and you go down the track of the arm, maybe a little bit tender. And temp it, that's fine, retract, finish. All over. Was that painful at all?
No, it was just slightly uncomfortable.
It is a little bit, yeah. It can be a little bit tender. And that's that. And that's how you take an implant out and put a new implant in. And just clean up the area. And then we'll just put some stereo strips on and then put on a small dressing. And obviously, if you use ethyl chloride, you have to wait until the coldness is gone, otherwise the dressings will just tend to fall off afterwards. We'll pop that on there. Do it again. So move your arm a little bit.
Mm-hmm.
Does that feel better?
Yeah, I think it's just where my arm's just been sat there.
It's been sat there for a little while, yeah. So you can still feel the implant again. Do you feel it?
Mm-hmm.
Yeah, that's all done. All finished.